Hello, it's 11 a.m. here in Seoul. I'm Woo Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus situation here in South Korea. In just a few moments now, we'll cut into the briefing room at the Sejong Government Complex with simultaneous interpretation available in English. So we're going to cut into the briefing room right now where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in the country. So we will be doing that just now. We're going to go into the briefing room here, as you can see on the screen, Sejong Government Complex, and Yoon Tae-ho is making his way to the podium, and it looks like the briefing is just about to begin.
And now we have the sign language translation available as well. And here is Mr. Yoon Tae-ho, who will be briefing us on the coronavirus outbreak here in South Korea. Let us now begin our regular briefing for April 23rd, Thursday. As of today, midnight, we have 8 new cases, and we have a total of 2,051 people in quarantine under treatment. The death toll stands at 240, and we had 2 more fatalities yesterday. I send my deepest condolences to those who have passed away and their members of the bereaved families. We have 8 new cases. Out of them, 4 have been identified here in the country, and 4 were imported cases. And a total of 2 cases have been reported at the airport quarantine, while the 2 others have been reported through the community transmission. All of them were South Korean nationals. The Central Disaster and Safety Countermeasures Headquarters held a meeting today, presided over by Health Minister Bang Neung-hoo, and he said that we are seeing a dwindling in the number of confirmed cases. However, we still cannot let our guards down as of yet, and he stressed that establishing an everyday life quarantine scheme is very important going forward. And also, starting from the 16th of April, we are having an encouragement campaign for the medical staff, dubbed the Thanks to You Challenge. And many of the public, celebrities, and municipalities have been taking part in this effort. And Minister Bang Neung-hoo said that he thanked all of them for such participation. We are continuing to see a decline in the number of new cases. However, we still see a global pandemic, and we do not have an effective therapeutic or vaccine as of yet. Therefore, we need to prepare ourselves for a prolonged outbreak going forward. To this end, the government is trying to transition ourselves to the everyday life quarantine, which is a sustainable measure, and it entails everyone to carry out their ordinary lives while keeping quarantine measures. And while practicing social distancing, we will also continue to come up with the guidelines that can be sustained in our daily lives. Therefore, we believe it is important to have strict quarantine measures, and also we need to find a compromise of these measures with the social economic cost as well. And these guidelines will be available on the COVID-19 homepage as well as the Health Ministry homepage. And the related ministries are also encompassing the opinions of related experts, and we will be providing detailed measures tailored to each and every different settings. The Korean society is witnessing its first ever social distancing measures due to the COVID-19 outbreak, and this is to be updated going forward, as we can have a more sustained measure going forward. So I ask for the public support going forward. And today at the KCDC meeting, we touched upon issues of effectively utilizing our quarantine supplies and preparing ourselves for the prolonged COVID-19. We need to keep a balance between the COVID-19 treatment and the regular treatment, and we also need to consider on how to utilize our hospital beds at the best rate possible. And so far, we have utilized 55 public hospitals and about 20 hospitals, private hospitals nationwide, and these have been designated as infectious disease hospitals, and we have about 7,500 hospital beds that are running for COVID-19, and now we would like to convert some of them to the normal to treat other patients. And we will begin to also move some of the hospitals to treat other patients, and we will carry out this gradually. And in early May, we will have also the operation of new hospitals and the hospital beds, especially around the Daegu and Gyeongbuk province, and they will be beginning to treat other patients, those other than COVID-19. And considering a possible widespread cluster infection, we will have at least 1,500 to about 2,500 hospital beds, at least for the COVID-19 patients. And these measures will be carried out going forward by phases. And also, we will have these phases and they will be transitioning within 10 days. And we will be transforming the designated hospitals to ordinary hospitals. However, we will always go back to the designated hospitals when big cluster infections occur. And the following is about the encouragement campaign for the medical practitioners. And starting from April 16th, we are doing an SNS, an online campaign for our medical staff, and many of the media outlets have been broadcasting on this measure, and so far we had about 2,600 people who have been taking part in these measures, and the public, the celebrities, as well as many heads of the municipal governments and institutions have taken part in this challenge, so-called the Thanks to You Challenge. And today, under the name of Thanks to You Challenge, we have this briefing, this badge that I have here with myself, and this will be given out to some of the public who have been taking part in the campaign. Moreover, starting from mid-May, we will be able to utilize the designs and the guidelines so that more public can wear these badges freely. And to this end, we believe that we would like to continue to pay our respect to the medical practitioners who are fighting on the front lines to combat the COVID-19 virus. And aside from the medical practitioners, there are still many heroes that are fighting at the front lines. There are janitors who are working to clean up the hospitals, and also those people are discarding the wastes and they spend sleepless nights. Moreover, we also have volunteer people who are delivering lunches to the vulnerable class, and there are also many civil groups, and there are also many volunteer workers who are working for quarantine efforts at each of the neighborhoods. And thanks to their efforts, we were able to fight against the COVID-19 going forward. The list goes on, so I cannot mention every one of them, but I would like to thank every one of them for their heroic deeds, and I ask the public to send their gratitude to all of them as well. The government, backed by their heroic deeds, we will continue to deal with any possible blind spots of these who are vulnerable to these diseases. So far, we were able to dispatch and mobilize people who have been able to support those people with handicaps, as well as those who are in the vulnerable class. And especially in the Daegu city, which was the epicenter of the virus here in Korea, we had about 180 people and 180 handicapped people. They have been getting these support services through some 1,800 people who have been volunteering. And we also had a lot of volunteers at the hospitals, and we also had more than 3,000 caregivers, and they were dispatched to each and every one of the cities here in the country. And going forward, we will have a caregiver platform so that when an outbreak comes like the COVID-19 outbreak, we will be fully prepared. Moreover, with the continued social distancing and the continued outbreak, we also have a 24-hour hotline to provide mental consultations for anyone who are going under difficulties. We have established a trauma center, and we have had over 80 treatment services. And also we had over 140 telephone consultations for people who are feeling very susceptible for this disease. And also, if you have any trouble, please call the hotline so that you could have mental consultations through the phone. And we highlight this multiple times, but we are carrying out the social distancing campaign until May 5th. Please refrain from unnecessary gatherings, and also when you use outdoor sports facilities, refrain from dining indoors. And we have a large temperature difference here on a daily basis, and you may feel cold-like symptoms. If you have any fever or respiratory symptoms, please do not go to work and stay at home for 3 to 4 days and take sufficient amount of rest and cancel unnecessary meetings and outings. And please comply with washing of your hands and coughing etiquettes and other personal hygiene measures. Until now, we have been able to exert our high level of civil awareness, and this has been helpful in making a safe society. Just as you did, please continue to cooperate with us so that we can have a social solidarity going forward despite the COVID-19 outbreak. I ask for your support in practicing social distancing campaign until May 5th and keep the personal hygiene measures going forward as well. Thank you very much.
That was a live briefing you just heard from South Korean health authorities updating us on the COVID-19 situation in the country. We just heard that there were 8 new cases of the COVID-19 here in the country, bringing the total to 10,702. And unfortunately, there were 2 more deaths, bringing the total death toll to 240. Well, that does it for our coverage of this morning's briefing. We will be back in just a little while at 12 p.m. Korea time with our midday news. Bye for now.
Hygiene is a priority because of the COVID-19. Battling COVID-19 by practicing good hygiene in daily life. Sophisticated buildings, clean streets, pleasant environment. We have done a good job maintaining a clean and pleasant environment, but because of COVID-19, we are practicing public hygiene even more thoroughly these days. Using its well-established hygiene control system, Korea strives to maintain public facilities and everything touched by people in a clean state and create a pleasant environment on the streets. Public hygiene is essential for our health.